I was having a lot of back pain, back issues when I was sitting. I couldn't really stand for more than a few minutes. The combination of those things and interrupting my sleep really made me think like I need to get this taken care of sooner rather than later.
Joe reached out asking for some advice, experiencing some pain as he's getting back to his normal life. Initially thinking it was some low back pain, and after having a chance to examine him and review his symptoms, we discovered that it was actually his hip that was causing the problems.
When I evaluated him, he was losing the functional range of motion of his hip. His hip was very tight on that side. And in addition to that, he was having daily pain. So we had a conversation about a hip replacement surgery, that this was a great option that can address the problem as opposed to a temporary solution.
Walking in the day of surgery, Dr. Ocengeli and I had the chance to talk with Joe in the pre-op area, and it becomes very human at that point when you're really talking about helping somebody that has an issue that you know that you can help them get back to doing the things they want to do.
Getting a joint replaced seems like a big deal, right? And there's a lot of things that go into it, not knowing how long the recovery was going to be, how I was going to handle the joint replacement. And so it was great seeing the comforting face of the UH nurses and the doctors. They would tell me, hey, we're taking great care of you.
The recovery for Joe went incredibly well. He was able to walk unassisted. He's going to go on to have great recovery and great adventures with his new hip.
I was really comfortable coming to university hospitals for my hip replacement surgery because there was a level of trust between myself and the surgeons. Dr. Voos was our doctor when I was with the Cleveland Browns, and I knew I was going to get world-class care. Just like everybody that walks through this building, you're going to be treated like a VIP all the way from the pre-op to the actual operation. You're going to have some of the best surgeons in the world, and then the care and the team that they've put together when you're in recovery, when you're in that post-op area, is second to none. And that's why I knew it was a no-brainer for me that I wanted to be at university hospitals for this procedure.
The spotlight and visibility that comes with taking care of professional athletes really requires us to be at the top of our games, not only with the technical skill, but building relationships and earning trust with our athletes. It also allows us to take care of all of our patients with that level of skill and level of compassion that we've developed with our athletes on the field.
Dr. Voos, Dr. Ocengeli, my physicians for life.